In this video, we will perform an end-to-side anastomosis using Castroviejo needle drivers and a 6-0-Prolene suture. The Penrose drain will simulate a native vessel and the graft will simulate a graft being sewn in an end-to-side fashion. Now we are ready to make the arteriotomy using an 11 blade, taking care not to go through the back wall. We will then extend the arteriotomy with pot scissors to the appropriate size. Initially, we will start most end-to-side anastomoses with stay sutures on the native vessel. This is done with a simple suture on each side, secured using mosquitoes or hemostats to hold that suture apart so it can hold the vessel open. In this example, we use 5-0-Prolene for our stay sutures. We now use a hemostat and an 11 blade to cut the graft in a spatulated fashion so that the size is appropriate for the arteriotomy. It is now time to begin the anastomosis, in this case using the parachute technique. As you can see, it is important to instruct your assistant on how best to hold the graft for your exposure. This line of communication will be continued throughout the procedure. We will start suturing at the heel of the donor vessel, 2 bites off the heel to begin. In the native vessel, particularly if arterial, it is important to sew from inside out to tack down the layers of the wall and thus minimize chance of dissection. It is critical here that we are careful to avoid locking our suture, reaching around the suture line so that we do not get ourselves tangled. We are also careful to follow through with the needle tip outside of the blood vessel so that it is easier to grasp. Not visualized here is the assistant following with gentle tension on the suture about 1/3 of the way from the suture line. This ensures the anastomosis stays secure and the remaining suture does not fall forward into the view of the surgeon, but allows enough length to continue working. After placing the first 3 to 5 sutures to get us around the corner of the heel, we will then bring the blood vessels down together and secure them with following. This is done with a gentle pull and tug motion from both ends of the Prolene, as well as from gently pulling up and down on the graft. As you can see, the parachute technique allows for the graft to sit nicely atop the native vessel. In general, it is preferred to sew the back wall of the anastomosis first, so that it is easier to visualize every bite going in and out of the vessel. Take care once again to make sure you are sewing outside in on the graft and inside out on the native vessel. Note we are using an assistant to hold opposite the heel to provide good exposure, such that you can maneuver the front end of the graft. At times, going backwards and forwards between forehand and backhand will make this easier to suture properly with the best bites as seen here. It is important to come in at right angles to the vessel as you are suturing, and to try and suture evenly with spacing and depth. Notice how the assistant preferentially pulls up on the suture when on the outside of the vessel. This helps evert the graft and promotes nice sealing. Try and really focus on having all the action happening in the field of the anastomosis, meaning that we are loading the needle and going back and forth in the field rather than passing suture off the field and loading the needle outside the view of the anastomosis. As we come around to the opposite corner, it is important to distract the 2 ends of the graft so that we can see where we are suturing. Again, you don't have to grasp the edge of the vessel each time to see the vessel to have proper orientation and retraction. But in fact, if you will distract the 2 vessels apart, you can many times get the suture where you want to go, using the sharpness of the needle to penetrate through. Again, we are focused on keeping the action of the anastomosis right there in the field, such that you are avoiding wasted motions. Loading the needle elsewhere and having multiple other maneuvers is simply not good efficiency of motion and time, and will make the anastomosis go much slower. We will generally sew in the direction toward the stay sutures, and once we get there, it is time to switch and go to the other suture. That way the stay sutures help hold the anastomosis open for the best visualization. Lastly, we will remove the stay sutures and secure the suture line by tying. We will start this off with a slip knot and then do at least 5 additional throws with the Prolene suture in an alternating pattern. Practice outside the operating room to maximize your experience in the OR. You want to practice needle handling, needle positioning, and keeping the action of loading and unloading the needle in the surgical field. Thank you for watching this video.